Our next speaker will be Dr. Jane Orient. Yesterday afternoon, the board of directors of this organization elected her president. She has been the president for as long as I can remember anyway. She's responsible for this meeting, our newsletter. She is the VP for 99% of effect. So I introduce Jane Orient. You may want to thank her for this meeting, which I greatly enjoyed.
I'm happy to throw away most of the notes that I wrote to give this presentation for several reasons, one of which is that I do want to finish fairly quickly so that a number of members of the audience can have a few minutes at the microphone. So let me tell you first what I'd like to do, and then since I can't actually do that, I'll tell you what I'm going to do. Like Dr. Pollico, some of us have had the experience that we've had to change some of the assumptions on which we've lived for a number of years. Some of my assumptions were accepting all of the ways that modern medicine does things. What I'd really like to do is to talk about the personal disasters that can confront all of us in the way of orthopedic problems like bad necks or bad backs, if your back has ever gone out, or you've had some other sort of orthopedic problem, and tell you something about what can be done about them. These are also a big contributor to the health insurance crisis, or the crisis confronting medicine today, several $100 billion a year spent on injuries and conditions for which modern medicine doesn't really have a very good answer. Included in these are some oddities like neurological conditions, Alzheimer's disease, multiple sclerosis, a number of other things that I used to think were untreatable and not much to be thought about, except trying to make the diagnosis and inform the patient. I didn't really change my thinking just because of meeting, quite by accident, Dr. Onley, but by meeting a Canadian neurosurgeon who used to, or he was an orthopedic surgeon, I guess, who had this idea that many of these neurologic conditions were because of a faulty blood supply to the posterior part of the brain, the back of the brain, that comes up through the vertebral artery in the back of the neck, and that can be impinged upon by a number of orthopedic type problems. He had a neurosurgical approach to that by inserting artificial disc disease, helped a lot of people, and gratitude for which he was delicensed in British Columbia. And I don't know what became of him. There is an orthopedic medicine approach to that also. However, it would be wonderful if we could solve some of the problems that are still facing medicine. I think everyone should think it would be wonderful if we could relieve causes of pain and disability and so forth. It's possible that not just everyone could think that way, and I had the experience of talking to a scientist who used to work with Jonas Salk. I think most of you breathed a great sigh of relief when the polio vaccine was discovered and thought, well, we don't have to worry about sending our kids to the swimming pool in the summertime. Polio has been conquered. But there were people who didn't like that. These were the people who owned the hospitals that were filled with iron lungs, which took care of all the thousands of children who could only live in an iron lung. They were not happy when the Salk vaccine was discovered. So there might be a few people who would be unhappy if we had some great advances in medicine. Well, I'd like to talk about the potential advances, but since I'm not qualified, I can't really do that. I'm going to talk more about just the situation, that what I think is a fairly disastrous situation that confronts medicine, and that may make it impossible for us to come to a solution of these outstanding problems anytime soon. What do you mean, disaster in modern medicine? American medicine is the best in the world, right? How many politicians have you heard say, America has the best healthcare system in the world? I've heard that so many times that I started to think, just because I've heard it so many times. But we also hear some other things that I'll try to tie together a few of the threads of this meeting. America is also the only remaining superpower in the world, right? We are so much of a superpower that our nuclear weapons are expendable, our submarines are expendable, our tactical nuclear weapons were thrown away a long time ago. We are trying to expand the ABM treaty instead of repealing it or renouncing it, as we should have done many, many years ago. We don't need any civil defense any longer. just an update for some people who have been active with me in the civil defense movement. As President Carney told you, that we are dismantling all of our radiation defense. The radiation meters that were purchased at hundreds of millions of the taxpayers' money were scheduled to be sent to a landfill. A few states have managed to salvage their meters. I know where quite a few of them are. Actually, I got control of all of them in the state of Arizona. The same country that is panic-stricken at the mention of the word nuclear is getting rid of all of its survey meters to measure the dose of this very dreadful thing. And interestingly, one of the biggest problems in even taking possession of these meters was a concern of the person who had custody of them, that they had a radioactive source on them. On the side of the Geiger counter, there's a little tiny check source that's a beta emitter, and he was terrified of this, not because he said, oh no, he knows better than to be afraid of the radiation, but he was afraid that an employee might sue him if they found out that they had been exposed to this, and I had to find out exactly what that source was and what the intensity was to try to reassure him about that. We used to have a program, or FEMA started a program to display equipment, life-saving equipment, for both nuclear, chemical, and biological disasters. Many of you in this room have been of great assistance in giving tours to thousands of Americans to show them equipment that really could save their lives. Good, economical, proven, effective equipment. And these steel shelter displays that were designed and built by the Oregon Institute of Science and Medicine by Arthur Robinson. Steve Alley took one of these shelters around the Northeast one summer. I spent about 3 months. My father and I were with him in Allentown, Pennsylvania at the Great Allentown Fair. Sharon Packer, who I think had to leave, helped us with the Arizona displayer. Now there she is. Maybe she goes to the state fair in Utah all the time with one of these shelters. Ken Lucas, who was here, or at least he was here, helped me at the Pima County Fair and the Maricopa County Fairs displaying this simple life-saving equipment. Well, you know what became of it? The state of Arizona had to get rid of it. It's now parked in my mother's backyard. It still exists, but this shows you the commitment that our government has to saving citizens' lives in the events of the various types of disasters that could engulf us. Well, we also know that America has the world's best science, doesn't it? And we learned a lot about that tremendous science here at this meeting today and what the present state of the scientific method in America. We have the world's strongest economy. Dr. Senholtz told us all about that. We have the world's best educational system. Men and women throughout the world send their sons and daughters to the United States to be educated, or at least they used to, and Dr. Sonera told us about that. Well, I'll tell you a little bit about the situation in medicine, something for which I have a little bit of first-hand knowledge. It's probably best described in a notorious novel called The House of God by Samuel Shem. His real name is Stephen Bergman, and if I may give a little plug for the Association of American Physicians and Surgeons annual meeting, he will be our banquet speaker. The setting of The House of God is at Man's Best Hospital, the MBH, which just coincidentally rhymes with MGH, the Massachusetts General Hospital, located in Boston, of course. I spent 1 month when I was a medical student at the one of the sister hospitals. I don't think this one was the scene of the House of God, but it might have been. That was the Peter Bent Brigham Hospital. And there I learned that HMS does not stand for Her Majesty's Ship, as in the HMS Pinafore, although Gilbert and Sullivan, I think, would have had a field day talking about events at the MBH. I had to sign my notes there very modestly as MS4. I guess I'm still a medical student. I think I'm about an MS24 now. I hate to take count. But the real people there signed theirs HMS for Harvard Medical Student. And that was obviously much better than the rest of us. I was only from man's second best hospital, second best medical school. That was Columbia PNS in the city of New York. And the reason I say it's the second best is that was in the assessment of my classmates, many of whom thought they deserved to go to Harvard, but since they had the wrong kind of accent, being from Bronx or Brooklyn, they had to settle with PNS. Nevertheless, at man's second best hospital, the laws of the house of God still applied. Some of these are, if you don't take a temperature, you can't find a fever. Another one is, the only good admission is a dead admission. And there was a modus operandi for patients that they called Gomers at Man's Best Hospital, and that was to buff and turf. That's to buff the chart, document everything so it looks good, and then turf the patient onto somebody else's service. Get them off your service. Well, things have only gone downhill from the house of God. Now we have Mount Misery. Mount Misery comes about with managed care, computerized diagnosis, more heavy-duty psychoactive drugs, and so forth. I was appalled to learn that at my alma mater, the accolades for the graduating class included that they are HMO ready. They're ready for managed care, which is rationed medical care for profit. Well, back at Man's Second Best Hospital, we did learn some things back in the 1970s when medical education was much better than it is today. We learned to treat peptic ulcer disease with the SIPI diet, the SIPI-2 diet, which was to give some people something like milk that transiently relieved their pain only to stimulate the secretion of acid an hour later. We learned that kidney failure meant death because the kidney experts at Man's Second Best Hospital did not believe in dialysis. The patient didn't want to die. He had the option of going down the street to Francis Delafield Hospital, the city hospital, where they had a dialysis program. We learned that EKGs had a really thick baseline. Back in the when electrocardiograms were originated, there was so much static in the machines that they had just a fat baseline. Well, they figured out how to fix the electronics so you could have a nice thin baseline, but the EKG guru wasn't used to that. She thought they were all supposed to have a thick baseline, so they crippled the machines at Man's Second Best Hospital so that we could have a fat one. And we learned that heart disease was treated with bed rest, up to 6 months of bed rest. And as we learned from Mr. Zubrin, if you put an astronaut out in space, or if you put anybody to bed for 6 months, you are guaranteed to turn him into a cripple. What we didn't learn about at Man's Second Best Hospital was very much in the way of anatomy. I've learned more about joint capsules from casually eating or cooking chicken than I did from either my anatomy class or my rheumatology class. And from Dr. Ongley, I learned how much I didn't know. But there was hope back then. We made advances in medicine since then. We have good EKGs now. We have wonderful imaging equipment now. We know we have better treatments for peptic ulcer disease. We no longer keep patients with heart disease in bed. We've learned lots and lots of things. Less invasive surgery, better anesthesia monitoring. And yet, the Association of American Physicians and Surgeons did a survey of every doctor in the state of Arizona, asked them what they thought about medical progress. With all these advances, 5% felt that medical care was getting better, and 67% thought that it was actually getting worse. It's not because of the science or because of the technology that we have at our disposal if we care to use it, but it's because of the political situation or because of what we are adopting in the way of forced deceptive rationing of medical care. And even more so with the abolition of the thing that is absolutely necessary if we are to have any progress in medicine or science or anything at all, and that is freedom. Today we have a lot of furor over the cost in medicine and furor over medicine itself. Not really concerned about stopping medical progress or anything. We're just talking about the costs. Costs keep going up, and in truth, it does not take a rocket scientist to figure out why. Even U.S. Attorney Ellen Burstyn, who is the new Grand Inquisitor in medicine, has told us why. And that is that we've separated the payer for medical services from the customer of medical services for the patient. Everything is paid for with other people's money. The opium of the masses is other people's money, socialism, and so forth. After Medicare, costs in the city of New York tripled overnight. Cost shifting is maxed out. But we're acting on the wrong diagnosis for why all of this trouble in medicine. We're saying, well, it's because of the bad apples. Our solution is to find scapegoats, or doctors. We've gone a long, long way toward the criminalization of medicine. The last time I talked to this group, I spoke about the AAPS lawsuit against Hillary Rodham Clinton et al., AAPS versus Clinton, where we objected to the secret operations of the Healthcare Task Force, which met behind closed doors to plot the takeover of 1/7 of the American economy. We sued them because they were clearly in violation of a law called the Federal Advisory Committee Act. Eventually, they did have to cough up the documents, which are at the National Archives. And eventually, the Clinton plan was defeated in Congress, or so we thought. That was, I think, in 1994. 2 years later, a Republican Congress brought back the worst third of it and called the Kennedy-Kassebaum bill. Actually, it's Kassebaum-Kennedy, but it was written by Kennedy, not by Kassebaum. It magnifies the existing penalties for types of what used to be billing disputes but are now called healthcare fraud. It makes every insurance billing dispute a potential federal crime. It federalizes all kinds of insurance offenses, whether they're public or private, vast expansion of the federal law enforcement apparatus, and turns just about everything you do in medicine into potentially a federal crime. Well, why doctors should care about this, I guess, is pretty obvious. Why patients should care about it is not too hard to figure out. It's partly what Mr. Guzzo gave you in his parting remarks. If they can do it to your fellow citizens, then they can do it to you too. I'll tell you just a few details about this legislation. That for knowingly and willfully misappropriating any of the assets of a health plan, you could go to jail. And misappropriating means to code things incorrectly, upcode it, or even to downcode it, because if you downcode it, that might be having an inducement for your services, something like a kickback. Fines of $10,000 per item in the civil sense if they can't really prove that you were guilty of a criminal offense. Asset forfeiture, where they can seize everything a doctor ever earned if they can convict him of healthcare fraud. The Medicare Trust Fund, which is facing bankruptcy now very soon, is going to be tapped to fund the coffers of prosecutors. However, this will be replenished by seizing the earnings, the savings, the assets of physicians who are convicted. Also, another way of misappropriating the assets of a healthcare plan is by providing medically unnecessary services. What's that? I don't know. It's a term that's undefined and undefinable. Of course, they do have to prove that there was a pattern of doing this. We're in San Diego, which is the former home of Dr. Jeffrey J. Rutgard, a rather notorious ophthalmologist who did more cataract surgery than a lot of other doctors put together in Southern California. Felt to be a very skillful surgeon. He resides now in a federal prison in New Mexico, I think. He's been in Fort Dix and in Oklahoma and a bunch of other places. There was a pattern of his cases, less than 1%. The federales went into his office and seized 20,000 patient charts. And after 2 years of intense scrutiny, they found 13 patients in which he had done questionable things like provide unnecessary cataract surgery. And, well, maybe some of those cataracts were unnecessary. There's a difference of opinion about him, but the jury believed the ones who felt they were unnecessary, and he was sentenced to 11 years in prison. Well, this is an example of really a profound change in the criminal law. It used to be there were laws against things like burglarizing, assaulting, and things like that. And so thou shalt not do it. And everybody was pretty clear on what it was that you weren't supposed to do. Well, now, it's not just thou shalt nots. It's that every physician everywhere is responsible for 100% affirmative compliance with the rules and regulations set up by an unelected bureaucracy. And, well, some of these rules and regulations concern like 87,000 forbidding coding combinations, of which 20% are in error, and they're always constantly changing. And furthermore, not only do they change, but you can't even find out what the definition is because the prosecutor makes it up as he goes along. Well, why should you care about this? Maybe you should care because every doctor who is not out of his mind is going to get out of independent practice as soon as they wake up and figure out what's happening. This is also a covert form of rationing. I told you Rutgard was accused of doing some unnecessary cataracts, and well, maybe he did. But the new definition of unnecessary cataracts, and doctors are being prosecuted for this right now, is operating on patients who are demented, who have a diagnosis of Alzheimer's disease. As long as you're a little bit confused, well, you can just as well be blind too. Going along with this, is vastly expanded subpoena powers of the Inspector General of the Department of Health and Human Services. It used to be that the subpoena powers were restricted only to the responsibility of that agency, which had to do with federal contracts. Well, now they can subpoena anybody's medical records on a pretext that there was some insurance fraud committed either by a patient or his physician. The other reason you should care is that everybody's constitutional rights are affected. Again, as Mr. Guzzo said, they came for the farmers, they came for the carpenters, and on and on and on. If they can do this to what were formerly the most respected groups of professionals in America, then I guess they can really do it to anybody. I told you a little bit about their methods at the banquet. Storming into the office commando style. Sometimes they kick in the door at 5 minutes to 9 when the office is supposed to open at 9. They seize all the records. They may freeze the doctor's bank account so they can't afford to hire a lawyer. I know of people who have been convicted on what I firmly believe to be perjured testimony. And then they come in with their guns drawn and they point their guns at patients, office staff, doctors, and little children. But this is an anecdote. I'll tell you more about the dangers of anecdotes later. I brought this to the attention of our state medical association, saying we ought to have something to say about these dangerous tactics that are being used to seize, things like medical records. I mean, after all, one of the first rules of firearms is that you never point a gun at somebody that you're not intending to kill. And either we have federal agents carrying around guns who have absolutely no training in the proper use of a firearm. Either that, or we have federal agents who are willing to kill a 9-year-old who just happens to be around the doctor's office, which was just adjacent to his home. Well, the Medical Society brushed it off. It's only an anecdote. They don't believe me. I've got reports from all over the country, but they don't believe me. I'm not sure how you convert these anecdotes into evidence. I mean, we write it down and on and on and on. And then they said, well, but there's a method for accountability. I mean, there's a procedure to be followed if some abuse like this happens. Well, Dr. Westmoreland did try to follow the procedure. He complained, and they laughed at him. They said, well, why were they pointing guns at my son? Well, he must have moved. Yeah, he was scared. He was standing there shaking. He doesn't want to be a cop anymore, by the way. Learned that. In our talk against AAPS versus Clinton, concerning that, I may have mentioned that we filed for sanctions against our magaziner in the Department of Justice for lying to the judge and for deliberately misleading the court. That motion for sanctions has been sitting on the desk of the judge for 2 years, and we have heard nothing about it. One thing the judge did do was give Ira Magaziner a choice of being either investigated for criminal prosecution by Eric Holder. You've read about him in the news. I think his confirmation hearing was last Friday. I don't know what happened, but he's up to be one of the most powerful people in the Department of Justice. Well, our magaziner had a choice between an investigation by Eric Holder or facing a civil procedure by us, and he picked Eric Holder. And Eric Holder decided there was no need to prosecute Mr. Magaziner. He didn't really tell a lie. He didn't really mislead the court. It was kind of a semantic game that they played. So much for accountability on the part of the federal government. But then there's more. It's not just a matter of prosecuting physicians for fraud with respect to violating insurance coding regulations. The Federation of Medical Boards wants to jump one step further and make it a felony offense for a doctor to engage in a, quote, questionable medical practice. Well, what's that? Well, everybody knows what that is. Some of these used to be called alternative medicine or complementary medicine, but now they're called a questionable medical practice. And in deciding whether or not the person is guilty in a court of law, there will be an effort specifically to exclude testimony from patients who were helped by the accused. That's not scientific, you see. Now, if we're talking about managed care, which is the politically correct form now, we use patient questionnaires to ask them how they like it, and we ask them when most of them are healthy, and they say, well, it's okay, and that's scientific evidence. But if you have a patient who was sick and who got well, then that's not evidence, that's an anecdote. The underlying threads that the AMA is trying to explain for what constitutes questionable medical practice. An emphasis on treating the source of the problem and not just the symptoms. Gee, in medical school they taught us to try to make a diagnosis. Maintaining the injunction to do no harm. Yeah, we swore an oath of Hippocrates in which that was the main feature, the one that most people remember. I shall never do harm to anyone. Another one is a belief that personal experience and anecdote is as reliable as a scientific study in determining whether or not something is effective. If the patient said he got well, he must be deluded, or he must have made the wrong diagnosis, and on and on and on. Oh, and anything with the importance of spiritual values to health, well, that's definitely dubious. Although right above the entry to Presbyterian Hospital when I was a medical student, you couldn't avoid seeing was a little phrase that of the Most High cometh healing. Well, doctors are going to be forced to use only approved treatment, only established practice guidelines that have been proved effective by a scientific study. Well, we've seen what scientific studies could be today. To do one that meets their criteria, you first of all have to have millions of dollars in grant money, and it has to be approved by the people who may be endorsing the competing method that we're now using today. There are some things that of course require a double-blind controlled study to try to figure out what's going on. Like if you have a treatment that marginally extends life on the average of 6 months over what it was before, like some of our cancer chemotherapeutic agents, well then I guess you have to have a double-blind controlled study. But what would they have done about scurvy? You know, there were lots of soldiers who were, or sailors who were about to die of scurvy. They had bruises all over them, their teeth were falling out, they were bleeding, and so on. Well, they gave about half a dozen of them a lime to eat, and they got well. Too small a study to do any statistics on. There are many types of therapy that simply the NIH does not wish to fund, and so it won't be funded. You'll have to be politically correct probably to get funded. It used to be considered that physicians were scientists. After all, they took 4 years of science in college, they studied science in medical school, they were supposed to be trained observers, and they were supposed to learn from their patients. I mean, most of what I have learned in medicine has been from my patients. And you know, Hippocrates really was the father of scientific medicine. He didn't have any multi-million-dollar government grants. He didn't use any statistics, but he did utilize the two key features of science, and that one is honesty. Well, we learned a little bit about honesty at this meeting. And the second was careful observation. And sometimes you can tell if things work by just, you know, as Yogi Berra said, you can observe a lot by watching, or you can, something like that. Well, I had a few anecdotes that I might tell you about. Of course, these are anecdotes. Just some observations that I made in Ensenada, Mexico, when I by chance happened to visit Dr. Angley. Well, just a real simple, obvious, straightforward thing. Sprained ankle. We had come into the... I know about sprained ankle because I fell on my ankle one time in fighting class, which is another story. But after that, I walked around in a cast for 3 weeks, and then with a cane for 3 weeks after that, and I couldn't drive because the cast was too clumsy to use a clutch. And after that, I still had atrophy in my left leg that you can still see. This was the modern up-to-date treatment for sprained ankle. I saw Dr. Angley, and this paratrooper came in on crutches with his leg all bandaged up, not able to bear any weight on it, sprained ankle. He walked out with his crutches over his shoulder, which I thought was kind of a nice dramatic touch. There are a lot of people who tell me that, oh, well, I'll tell you about one other, a nurse named Carmen who came in wearing a hard cervical collar, scared out of her mind, scheduled for surgery, had been unable to work for 3 months. And the next time I saw Carmen, she was dressed in her uniform, did not have a cervical collar on, was turning her head from side to side freely, big smile on her face, back to work, no surgery. I have brought with me today Exhibit A. Would Exhibit A please raise your right arm above your head? Yeah, okay. Exhibit A, there's my father. He's another anecdote. He showed up on my doorstep one day complaining that he had fallen down on the concrete, hurt his shoulder, and he couldn't move. He couldn't take his shirt off. He couldn't shift gears on the truck. He was in great pain, and I looked at that and said, hey, this is going to turn into a frozen shoulder. I learned about this in medical school. You give him some non-steroidal anti-inflammatory medicines. You give him a few little exercises of the shoulder and look forward to many, many months of rehabilitation, MRIs, possibly surgery, and so on and on and on. But my father was not content with that. Didn't you learn anything going to Ensenada? So I got out the big needle and I got out my copy of Sabata's Atlas of Human Anatomy, which I didn't even own when I was in medical school, but boy, it's pretty well thumbed now, and my Syriac's textbook of orthopedic medicine, and I tried to remember some things that I had seen Dr. Angley do. One of the most important things I learned from him is what's possible. So my father was my guinea pig number one, and I can't say that I was at all skillful at this. It took many, many tries before I hit what he calls the eureka point. But the next day he was out swinging his hammer, shifting gears on his truck, doing this, feeling much better. And I, who am the most abysmally ignorant doctor of orthopedics in the whole world, sort of proved to myself that, well, maybe even I too could learn something. And if a method is teachable, well then maybe there's something to it. Maybe it's not just an anecdote. Maybe it's a cased history. Maybe it's an observation, a scientifically valid observation that we could repeat over and over again, obviously to see if it works. But if you put me in a controlled study and gave me a choice of getting a needle in the proper place versus wearing a cast around for 3 weeks, guess which one I would pick? Well, what has happened in medicine, what has gotten us to the state that we're in, the topic of my speech is I'm supposed to tell you, well, what American medicine must do to survive. And I would say the most important thing that we have to do is to restore the thing that enabled us to progress as far as we have, to correct the mistakes that were being made, some of the mistakes that were being made back when I was in medical school, and that is freedom. Freedom of inquiry, freedom to investigate, freedom for patients to choose the type of medical care that they want to receive, and for physicians to choose the type of medical care that they want to give. What can you do these days? I would say the first thing is that you must not take their money. There's been a certain sequence of events. You know, we've talked about education and science and on today, but there was a sequence of events. You know, there was federal aid to education. As my 7th grade math teacher pointed out to me, if you take their money, they'll tell you how wide to make the door. But they didn't stop there. They started telling you what you could have in the book and what you couldn't have in the book. Then we had federal funding of science, which has become almost the exclusive method of funding of science. And we've had federal funding of medicine. A huge proportion of medical expenses are paid for today by the federal government. If you take their money, you become an accessory to the crime, and it is a Faustian bargain. What can we do? We need to arouse public awareness of this fact. Maybe one thing you personally need to do is to remember what I said about Highway 5, and how not to get lost in Tijuana. We've heard Martin Kamen say that, well, maybe we can sit back and wait for things to get better. As you might have guessed, I am not of the sit back and wait school of thought. Some of us feel like there will come a time when we're going to have to take a stand, kind of like they did at the Alamo. Some of us feel like our offices are rather like the Alamo already, only the federales that are invading them are not under the command of Santa Anna, but are being taking orders from Washington, D.C. We know that Davy Crockett died at the Alamo, which is not a good thing to contemplate, but we also know that he was there because he lost the battle in Congress. And since he lost the battle, it's been getting worse and worse. There's a little pamphlet called Not Yours to Give, Davy Crockett's view of accepting their money, accepting something that seemed like, for all intents and purposes, a wonderful good deed, disaster relief. Took their money. one thing led to another, of taking from somebody else to give to sprinkle around in a few good deeds, but really Maine is going to increase the power of the government and the bureaucracy to bring the straitjacket tighter and tighter around all types of worthwhile enterprise, including the practice of medicine. Senholtz didn't talk about this today, but I think in a previous talk to the AAPS, he told us what the answer was. Do not partake. You do not need to partake of their money. Don't do that. Maintain your freedom. Tell the world about it. Insist on asserting your rights as an American citizen. And maybe we'll win. If we don't, at least we can't say that we surrendered. Okay. Okay. He wanted to ask a question.
Okay. Just one.
Okay. Well, we have time for one question, Dr.
Okay. I have a little comment first, Jane. As you recall, I graduated from Harvard Medical School and did my residency at the MGH. And using a static model of human behavior, you can be assured that there should be a great reservoir of human talent there, because so much talent flows into the reservoir and so little flows out. However, I am afraid that a great deal of it is indeed destroyed. But my question is that I have heard a nasty rumor that your marvelous book, Your Doctor Is Not In, is no longer available at your local bookstore, and I would like to inquire as to how it might be available and how some of us might be able to acquire it by, say, the case or so.
Well, all of the remaining copies are in my garage, and I'd be glad to provide you with one. The phone number of my office is 1-800-635-1196, 635-1196. I'd be glad to sell you a copy of my book if you would like it. Oh, and there's a new one coming out called Sutton's Law. Sutton's Law has to do with where the money is in medicine. That will be out in September, I think.